Welcome to this Chemscape video on chemicals and their effect on reproductive health. You may not consider your job as a possible cause for reproductive problems, but some workplace hazards can affect male and female fertility, as well as the health of a developing fetus and child development. Whether you are considering having children now or not, reproductive hazards matter for both men and women. Exposure to hazardous chemicals can affect your reproductive health or your family's health. You can carry chemicals home on your skin, hair, clothes, and shoes. Some of these can harm the health of children and other people in your household. Many chemicals in the workplace haven't been tested to see if they can cause reproductive problems. Laws for workplace safety and health don't always protect your reproductive health and the health of your family. Male sexual function, sperm, or semen can be affected by workplace hazards. Some chemicals can concentrate in semen. Females who are exposed to hazards at work and are pregnant or breastfeeding can also expose their baby to hazardous chemicals. Here is a list of reproductive and sexual health problems for men and women caused by exposure to certain chemicals. Reduced fertility or infertility, erectile dysfunction, menstrual cycle and ovulation disorders, women's sex hormone imbalance and associated problems, miscarriage, stillbirth, babies born too soon or too small, birth defects, child developmental disorders. Due to the nature of the female reproductive system, exposures that may impact fertility can also impact general health. Let's review some female health problems that may be caused by workplace reproductive hazards. High levels of physical or emotional stress, or exposure to chemicals such as pesticides, PCBs, organic solvents, and carbon disulfide may disrupt the balance between the brain, pituitary gland, and ovaries. This disruption can result in an imbalance of estrogen and progesterone, and lead to changes in menstrual cycle length and regularity and ovulation. 10 to 15% of all couples have infertility, which means that they are unable to conceive a child after 1 year of trying to become pregnant. Many factors can affect fertility, and these factors can affect one or both partners. Common causes of infertility include damage to the woman's eggs, damage to the man's sperm, a change in the hormones needed to regulate the normal menstrual cycle, and uterine growth. Some workplace exposures can cause an imbalance of estrogen and progesterone levels in your blood, resulting in an elevated risk of some cancers, such as endometrial or breast cancer, osteoporosis, heart disease, tissue loss or weakening, effects on the brain and spinal cord, including symptoms of menopause. Reproductive hazards can vary between women or every pregnancy. Factors affecting exposure and harm include the type of hazard, how long you are exposed, how much of the hazard you are exposed to, how you are exposed. A woman's age, stage of menstrual cycle, stage of pregnancy, or timing of exposure also play a role. For example, exposure to a hazard could block ovulation and pregnancy only at specific times of the menstrual cycle. Exposure during the first 3 months of pregnancy might cause a birth defect or a miscarriage. Exposure during the last 6 months of pregnancy could slow the baby's growth, affect its brain development, or cause premature labor. Let's now look at male reproductive health. Male reproductive health would include the health of their sexual function, sperm, or semen. This can be affected by reproductive hazards. Over 1,000 workplace chemicals have been shown to have reproductive effects on animals, most of which are not tested for reproductive health effects in humans. Examples include radiation, pesticides, various chemicals and solvents, legal and illegal drugs, cigarettes, heat. Some reproductive hazards can change the level of hormones in a man's body. This could affect how sperm are made or the man's sexual performance, like low libido or erectile dysfunction. Reproductive hazards can stop or slow sperm production, resulting in a low sperm count or even sterility. Reproductive hazards may alter the shape of sperm, causing them difficulty in swimming to reach and fertilize an egg. Reproductive hazards can affect the genetics, DNA, found of the sperm. This can affect the sperm ability to fertilize an egg, or can affect the normal development of the fetus. Reproductive hazards can affect male semen. Hazardous chemicals may collect in the parts of the penis, and these chemicals may kill the sperm, alter their ability to swim, or attach to the sperm and be carried to the egg. Some reproductive hazards reduce the amount of semen, which results in the fluid not transporting the sperm to the cervix. Reproductive hazards can lower ejaculation quality, interfering with the ejaculation process, so sperm cannot reach the cervix to reach the egg. Men and women can be exposed to chemicals at work by breathing the chemical in, contact with the skin, especially if skin is chapped, irritated, or there is an open wound, hand-to-mouth exposure. Whether or not chemicals cause health problems depends on the amount of time a person is exposed, the amount of the hazard they are exposed to, how they were exposed, how your body reacts to the hazard. Pregnancy can affect your health as a worker. A fetus can be more vulnerable to some chemicals because of its rapid growth and development, particularly early in pregnancy when its organs are developing. Pregnant workers can modify duties or take extra steps to protect themselves. Current occupational exposure limits are based on studies of male adults. What is considered safe for you may not be safe for your unborn baby. Pregnant women experience changes in their metabolism, increasing how quickly you absorb some chemicals. Because of physical changes, PPE may not fit properly, such as lab coats or respirators. Changes in a woman's immune system, lung capacity, and even ligaments can increase the risk of injury or illness. If you are breastfeeding and working with chemicals, it is important to review the chemicals you are exposed to, as some chemicals can enter breast milk and eventually expose the baby. Here are some examples of a few chemicals that can get into breast milk: lead, mercury, and other heavy metals, organic solvents, and volatile organic chemicals, chemicals from smoke, fires, or tobacco, some radioactive chemicals used in hospitals for radiation therapy. Let's review how to reduce exposure to reproductive health hazards to keep you and your family safe. Evaluate your risk by identifying the chemicals you may be exposed to in the workplace and understanding their hazards. Review Section 2 of a safety data sheet for the health hazards of a product. The health hazard pictogram represents serious health hazards, including reproductive hazards. Hazard statements will list reproductive and lactation hazards. Chemscape has reports that identify chemicals in your inventory that target the reproductive system. The best way to reduce the risk of exposure is to eliminate the source of exposure. See if the hazard can be eliminated by selecting a less hazardous product or substituting a process or material where possible. Substitution and elimination is the most effective control. Our CHAMP program suggests substitute products. Follow the guidelines for recommended engineering controls to reduce exposure where available. Engineering controls only work if you use them. Using a hood or intake at or over the source of exposure, which draws contaminated air from the source so that it cannot spread into the room and into your breathing zone. Check that the ventilation system is working properly at all times. If the ventilation system becomes faulty, leave the work area and inform your supervisor immediately. It's important to wear PPE if it has been recommended at your workplace. It is intended to reduce your exposure to hazardous chemicals. PPE needs to match the task and the type of chemicals. PPE has to fit correctly. Wearing PPE does not guarantee complete protection for you or for an unborn baby if you are pregnant. Remember, chemicals don't stay at the workplace and can accidentally travel home with you on your skin, hair, clothes, and shoes. They can contaminate your car and home, where your pets and family members can be exposed. This is called take-home exposure. Many chemicals have not been tested for safety in children. An end-of-day work routine can prevent take-home exposure. Keep chemicals out of your home by keeping them at work. Wear protective work clothing so that chemicals do not get on your personal clothes. Don't bring work shoes home. Change out of work clothes before going home and store separately. Take a shower or wash hands before going home. If you can't change clothes or shower at work, reduce the amount of chemicals that enter your home by Remove work shoes in your garage or as soon as you enter your home so you don't bring chemicals into the home. Change out of your work clothes right away. Wash your work clothes right away if you can. Wash your work clothes in a different load of laundry from your family's clothes. This keeps chemicals on your clothes from getting on theirs. Wash your hands or shower as soon as you get home. There are hazards besides chemicals that can affect your reproductive health, including radiation, loud noise, long working hours, shift work, or irregular work schedules, lifting, bending, and standing. For many situations we discussed, like fertility, pregnancy, breastfeeding, sexual, and general health, a discussion with your doctor is important. Your doctor can help assess your risks at work for your personal situation and recommend if tasks need to be avoided or modified. This concludes the presentation. Use the knowledge you have gained from this presentation to protect your health in the workplace and in your personal life. Please consult a health and safety resource for your company and regulations in your area for specific requirements.